Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob. Very interesting questions, and probably one of the most popular questions that I receive on a regular basis is, how do you stop thinning hair? Well, I want you to know that some of you may have thin hair just because of the genetic makeup on your body. But I've also noticed individuals who have come into our practice who have thinning hair, hair loss. A lot of different reasons. Number one, always have your thyroid checked, especially for ladies. Thinning hair, hair that becomes sparse, could be subpar thyroid function. Not to be silly, but if you're losing hair, it could be a condition called alopecia. That's caused from stress. Other reasons for hair loss could be not enough of the right oil in your body. In other words, some of you are consuming a lot of omega-6 fats, which cause inflammation, and I've noticed more and more young people today, 40 years and younger, they shave their head because they don't have enough hair. So I would suggest probably the first start looking into your thyroid. Have a TSH, a T3, and a T4 blood test done, and consider a TPO for Hashimoto's or thyroiditis. Dr. Bob, what is your thoughts about adding hydromolecular supplement to water? You know, I have a lot of water questions, and I know recently I made a statement about alkaline water creating some potential digestive imbalance in the body. You know, it really comes down to drinking water from a pure source. You know, as a species, we've been on a planet for a long time, and we've survived very well. And I just know that right now there are more and more companies that create a variety of different types of water. I basically drink reverse osmosis water. I don't usually try to drink tap water. I avoid spring water. I really never try to use a lot of any kind of water that have had various chemicals added to it. I want you to know with some of the testing that we have in our practice that I've seen a lot of people that maybe have used hydrogen peroxide or acetone peroxide and other chemicals that literally show up in a biocommunications survey that we do. So I drink water from a pure source. Dr. Bob, I have cancer. And do you have any suggestions in regard to all the harsh chemicals that they have me on? Well, from our experience, there is an item that you can use called chlorella. Chlorella has been designed to help eliminate some of the side effects from chemo and radiation. Many years ago, when I was studying for my Doctor of Natural Health degree, I read a book called The Answer to Cancer by Dr. Sharma. And in the book, he created actually a recipe of items of food to consume as you're walking through that chemo process. Dr. Bob, what causes the need for one to crave marijuana? And this person said, trying to help somebody that they love. What's kind of interesting is that a lot of times addictive type of personalities may be a body signal that somebody needs B vitamins. B as in Bravo. And we've used B vitamins along with some other nutrients for individuals who are trying to minimize or eliminate their craving for tobacco, for cigarettes, or pipe smoking. So a B vitamin is a good idea. Also, we've used something called L-lysyme, which is a vegetable-based lithium. It helps people hopefully kind of contend with some of that passion addiction, but I would definitely go with B vitamins. Dr. Bob, K2 appears to be a very important supplement my dad might need. You know, and the whole K aspect of with blood coagulation has been a really hot topic right now. You know, I really don't ever talk too much about any of the K issue. I've listened to a couple of CDs and information when it comes to this whole level of K2. You know, one of the areas that we really focus on in our practice, just to keep it down to some simple basics, is the proper metabolism of fat and oil. You know, one of the very first questions we were talking about was the cure for thinning hair and too much omega-6 fat. If I had someone and a loved one that was having some issues with blood and taking aspirin, I would have an essential fatty acid blood spot test done. A case in point, I had somebody that came into my practice the other day. He had a lot of bipolar issues, and I know that the food that he was consuming was high in trans fat and the omega-6 fats themselves, and he was underneath psychological evaluation. Well, we talked about what he was eating, and he was eating a very popular, healthy, all-natural salad dressing. And I went to the ingredients on the website, and the food and the ingredients in that salad dressing were sabotaging his health. So rather than taking K2, I would encourage a blood spot, an essential fatty acid blood spot test, and then make your decisions from there. Tremendous questions. Thank you for thinking. I'm Dr. Bob DiMaria, the Drugless Doctor.